Eggs. They seem innocent enough, but over the years their reputation has taken a bit of a battering. In the past, they've been accused of causing an increase in blood cholesterol levels, which in turn raises the risk of heart disease. However, in recent years, other studies have said that's simply not true. But finally, health organisations, including the British Heart Foundation, have reached a consensus. Well, joining me here at the Royal Society of Medicine, where the news has been released, is Dr. Hilary Jones. Dr. Hilary, have egg eaters got anything to be pleased about?
They do have something to be pleased about, because now we can say quite so honestly and openly they can enjoy eggs on a daily basis. They don't have to count the number of eggs they're enjoying. They can put them in their ingredients of the food that they cook and the eggs that they enjoy, and they don't have to worry, unless, of course, they've got a condition called hypercholesterolemia, which affects about 1 in 500 of the population. For those people and for people who've had existing heart disease, there still might be some restriction, but for most people they can enjoy eggs as many as they want. They don't have to count them anymore.
How significant is it that some kind of consensus has been reached by the medical fraternity?
I think these days it's quite unusual for all doctors to agree that this product or that product is healthy. Now we have all doctors saying we now understand that actually we were wrong to restrict our egg consumption. We've got people like the British Heart Foundation, the American Heart Association, people like the Food Standards Agency, and all doctors saying absolutely fine now to eat eggs with impunity, really, because it isn't the cholesterol in eggs which is the problem in causing high cholesterol in our blood. It's saturated fat in our diet which is converted to cholesterol, which causes the problem. So eggs have been wrongly labelled in the past. They've had a bad press.
Dr. Hilary, thank you very much indeed. Well, as Dr. Hilary said then, sat fat could be one of the key causes of giving people heart problems. Earlier on, I caught up with Professor Bruce Griffin, who's the author of this report. He enlarged on that.
Saturated fat has a much greater, on a weight basis, cholesterol-raising potential than dietary cholesterol. The problem has always been that dietary saturated fat and dietary cholesterol occur together in the same foods, and it's been very difficult to try and dissect out their two effects on blood cholesterol. We've been able to do that in the last 20 years of research, and it's become evident that saturated fat does have, on a gram per gram basis, a more potent effect in raising blood cholesterol, and that's really the most important dietary strategy for preventing coronary heart disease risk. It's to remove more saturated fat and not worry about dietary cholesterol in such foods as eggs. What prompted the review was a change in the advice that's being given by health professionals and dietitians. This is really based on bodies such as the British Heart Foundation changing their guidelines and lifting the restrictions on egg consumption, which was formerly restricted to 3 eggs a week. And they have now changed that. Likewise, the Food Standards Agency hasn't placed any restriction on the intake of eggs, largely because they're now realising that there is no evidence to support the relationship between dietary cholesterol, blood cholesterol and coronary heart disease risk.
Professor Bruce Griffin there. Dr. Hilary, this new consensus is of course very good news, but how hard will it be to change the public's perception of eggs?
Actually, eggs are fine. In fact, not having enough eggs could be detrimental to your health, because we know that they're high in protein, we know that they're micronutrient dense, or nutrient dense, so lots of vitamins and minerals. We know that they are very low in saturated fat, and that people enjoy them. So not only are we saying this is healthy food, but it's enjoyable food, and you don't need to restrict it anymore.
And how important a role do GPs have to play in all of this?
I think the role of the GP is vital. After all, millions of people come through the GP's doors and ask for advice about lifestyle, about giving up smoking, about keeping their weight down, about exercise and what they should and shouldn't eat. It's important that updated, up-to-the-minute advice is given based on good clinical research. If people want to avoid heart disease, they want to avoid high cholesterol levels, the message that GPs have to give is reducing saturated fat that's vital, not worrying about dietary cholesterol that comes from shellfish or eggs.
Dr. Hilary, thank you very much indeed. Well, 29 million eggs are eaten in Britain every day. Now, those people who do eat them have less to worry about.